From the standpoint of the physicians and the providers, Careguard allows a lot more revenue to flow to them, because what it's going to do is it allows things like fall prevention to occur. It allows lifestyle and deprescribing and dementia reduction. And if you have lifestyle coaching, that does not take away from remote patient monitoring or therapeutic monitoring or CCM. So lifestyle coaching, which is part of Mesura, allows 26 visits a year just for lifestyle coaching, and that's billable as an ancillary service. And so the physician or the nurse practitioner does not have to do that directly. It's done through our lifestyle coaching program, and that revenue is shared with the ownership group or the physician group that is managing those patients. If we discover that the patient has a vestibular imbalance issue, there are devices that can be added that are part of remote patient monitoring that can help reduce the risk of fall. If we discover that the patient is pre-diabetic, well, normally a glucose monitor might be done before a meal or after a meal, and then it's ignored the rest of the time, and it takes a lot of resource. But what about if we put a CGM on that patient, a continuous glucose monitor? Well, you can monitor that 17 days versus greater than 16 days out of the month, and the facility or the physician gets compensated for that remote patient monitoring, and they don't have to be physically present. We have an entire service that does that. Chronic care management, we help identify all of the disease processes that we can quickly identify and enter those into your EMR system. So it gives you, as in terms of HEDIS scores and MIP scores, far more information. All of these things help drive the revenue for the physician. They help drive additional ancillary services revenue for the facility, and they dramatically improve the patient care and reduce the overall burden of care to society. It's interesting. If you spend a little bit of extra money individually, you can really reduce global costs. I'll give you an example. If you identify that the patient has diabetes and their hemoglobin A1C, which underestimates diabetes, by the way, if their hemoglobin A1C is elevated and they're on insulin, but you are able to reduce their global consumption of carbohydrates and you're able to reduce their type 2 diabetes and get them off their insulin, it does a couple things. The patient loses weight, which is great. It also allows the patient to be more functional and increase their activity level, and they do extremely well from that standpoint. And at the same time, it allows improvement in their cognitive function. So they're not wandering. So they don't have a Alzheimer's picture or cognitive impairment, and hopefully decreases their risk of fall. And it also allows you to deprescribe the insulin. So you could save $1,200 to $1,400 a month just deprescribing the insulin. You could save $50,000 to $60,000 a year by preventing that hip from breaking. You could reduce the cost care burden inside your facility because it takes less therapeutic monitoring inside the facility and less caregiving because the patient's able to do more self-care. So all of these things globally improve the patient's outcome and globally reduce the cost, even though you spend a little bit of more money trying to figure out from the Mesura side what's going on with the patient. So it's a balancing act, but it's a 10-to-1 ratio return. And I would do that any day of the week. If you spend $1 and you make 10 for the patient, that's well worth it. So sometimes it may look like, well, I'm going to spend a little bit more money because I'm doing this Mesura protocol, because I'm going to monitor the patient's toxicology level, or I'm going to monitor their urine. But globally, you just saved a $40,000 admission, and the patient is retained in your system. It doesn't get discharged. So spending a little bit of money saves a lot, and really lengthens the lifespan of the patient and the health span. And that's what we're trying to do.